Hi, I'm Dr. Bob Graykowski, creator of the Better Brain Blueprint. Today we're talking about a thing called cranial work. Cranial work is a way that you are actually stimulating the nervous system. It's affecting the nerves of the brain. It's affecting the nerve pathways in the brain. It's affecting the circulation, the vascularity in the brain by putting pressure on certain areas. If you rub your skin and you look at it, what happens? You get this thing called hyperemia, which is a redness. There are different points on the skull where the sutures or the bones of the skull come together that can be affected. Maybe you've had a head trauma and one of the sutures are overriding. This is affecting the circulation to different parts of the brain based upon what level of overriding or shifting is taking place. There's a very specific analysis and examination of the skull. Dr. Roger Turner is one of the foremost people that train this technique, sort of this cranial work, so you can actually do an examination and determine what part of the brain might be affected based upon what you see. So if I look at my buddy Harry here, if we look, there are different sutures of the skull. These are like zippers. These are where the nerve or the skull bones come together. All these different sutural points can override. When we do a treatment, we actually do an examination. We feel these areas, and we actually work at separating what's called the fascia, the covering around the skull, but also realigning and getting movement. Every breath that you take, the skull has to actually have a micro expansion. If we have a process where these start to harden and ossify, it affects brain circulation. Most of this blood supply to the brain is on the external part of the brain, and then it goes in through some of the main arteries. So you can influence this by certain processes of cranial work, working different parts of the skull. One of the most important areas, if a person has an injury to the side of the head, the temporal area, this is one of the areas that will affect the brain the most. You can actually get a brain bleed inside if you have an injury here. If there's ever an injury to the side of the head, you have to have that checked out. It's important to make sure that that there is not some sort of a concussion or a subdural hematoma, a brain bleed. When we look at these processes, I've had patients that literally years before getting hit by a baseball bat, falling out of a tree, hitting their head, falling on skates, doing the birth process. When we had our helicopter crash, Janine's injury was to the right side of her head, so she had a lot of injury here. Working this point called the sphenoid, the center part of that bone affects what's called the pituitary. So if that is off, it affects the hormonal levels and circulation. So there's a very specific examination that we do in our office, that we show our patients how they can actually do certain things to not only self-help, but in an examination process, we need to find out where these areas are and start to correct that to affect circulation to the skull. So if you've ever had a brain trauma, you should have cranial work or cranial examination to see how you can realign and reassess these processes to affect your overall brain health, which affects the overall health of your entire body. So today we're talking about cranial work and how stimulating the skin, stimulating these receptor points in the skull affect your overall brain health now and in the future. This is another Better Brain tip from Dr. Bob. Have an awesome week.